Hello everyone, my name is Matt Harris and I'm an ABC certified prosthetist and orthotist. This is a new channel that I've created dedicated to answering questions related to the field of orthotics and prosthetics. On this channel, I'll be answering submitted questions, reviewing clips, and providing general information and educational material for the field. Please note that while I am a medical practitioner, I am not a doctor. If you are a patient being treated with a prosthetic or orthotic device, please consult with your practitioner or doctor for any treatment. All statements made on this page are the opinion of myself and no other person or entity. I am not giving any medical advice. I am just giving my opinion on different issues that involve prosthetics and orthotics. Let's get started today with a question that was submitted to me. My question was, when considering suspension techniques, what is the thought process behind each style and why would you want to use that style on a patient? This question was submitted by a student. It's an excellent question. To start, by suspension, we mean how a prosthesis is kept on the body. And the main forms of suspension are mechanical, passive suction, and elevated vacuum. Mechanical suspension could involve straps that are anchored to a waist belt, which is an older method of suspension, pin locking systems that are at the distal end or bottom of a prosthetic socket and connect to the gel liner with a pin that has a ratcheting system to it, or a lanyard style system which has a strap that goes through the end of the socket and attaches through a chafe on the front or the side of the socket. It allows the patient to pull themselves into the prosthesis. This is an excellent suspension type of system for a fleshy limb that needs a lot of containment. Lower activity patients with limited dexterity are the best choice for this system, unless it's a user that's had a lot of success with it in the past. In addition, patients who suffer from vision problems do well with the pin system because they can hear the clicks as the pin engages, which tells them that their limb is secure. The drawback is that these systems require increased length in the prosthesis, so on a longer limb may limit the choice of componentry that you can use. The second type of system, passive suction suspension, utilizes a one-way expulsion valve to expel air and moisture from the socket at the distal end or the bottom of the socket, sometimes on the side of the socket or the back of the socket, depending on patient preference. This system requires a seal, whether it be by a gasket or O-ring around the outside of the patient's liner that they roll on, or a suspension sleeve at the top of the socket or the proximal end that seals to their skin. This system is fantastic for bony limbs that would not tolerate the umbrella that usually accompanies liners that have the pin system or a lanyard system. I like using this system on patients who have more developed limbs and have good dexterity. These systems are shorter and allow for a wider range of componentry. The drawback is that the valves can get dirty and leak, and it's best put on somebody who's able to consistently don their prosthesis properly. Donning means to put their prosthesis on. Finally, elevated vacuum works similar to passive suction in that it expels air from the socket, but the difference is that they use a mechanical pump that's attached to the socket and actively draws the air out of the system. This type of suspension is good for people who need help with volume control or have problems with sweating, as it stabilizes limb volume, and the contact that you get from the vacuum actually reduces the amount of sweating. The drawback is that pumps add a little bit of weight to the prosthesis and can add length. Also, if there are any voids in the socket or if the patient has any air bubbles between their skin and the liner, it can cause a blister to form. Again, this system is best for somebody who can consistently put their prosthesis on. So that was today's question. I hope that I was able to provide you with some helpful information. If you enjoyed the video or felt that it was helpful, please leave a like, subscribe to the page, and leave a comment. If you have any questions, please submit them to askaprosthetist@gmail.com. God bless and have a wonderful rest of your day.